is some discussion about whether bringing in foreign doctors to a country is good for patient care or bad because it could reduce standards. I put that question to Thomas Bollyky from the Council on Foreign Relations.
Countries in general, I think there certainly are some benefits. Remittances in particular, doctors sending money back, nurses sending back to their relatives in the country, and that's a big source of income for a lot of developing countries, more so than aid, for instance. But it is a challenge for the health system. It limits the number of doctors they have in that health system, so it can be a challenge for countries like Ghana, which loses 1 out of every 3 doctors who move abroad to practice. It's a problem for them. For Cuba, on the other hand, it's leading export commodity are doctors. They really rely on the ability to send doctors abroad as a way of bringing hard currency back into the country.
Well, let's talk about Cuba for a moment, because they have been practicing this doctor or healthcare diplomacy for quite a long time now. Are they taking doctors' jobs from the countries they go to, or, is that a problem at all?
It is not a problem. In most of the countries they go to, those countries are suffering an enormous shortage of doctors. The roots of Castro care, as some people call it, the humanitarian use of doctors from Cuba, were originally to work in other Soviet bloc countries or to respond to disasters like the tsunami or the earthquake in Haiti. But in recent years, they've been loaning them out for money.
Are we going to see more countries passing bills to allow foreign doctors in? Is this a growing trend?
It is definitely a growing trend. There's more healthcare services are needed, particularly in Latin America. You see an explosion of the rate of diabetes, cancer, these chronic conditions that need a lot of medical care. And you need doctors and nurses to provide that care. And I think you will see more countries opening up their medical system to foreign doctors, a way of meeting that need. That's happening in the U.S. now, too. The U.S. has a big shortage of doctors. It's expected to be 125,000 doctors short by the year 2025, and the Affordable Care Act may even accelerate that.
Well, but here in the United States, it takes a very long time for foreign doctors to become qualified or licensed to practice here in this country. And some believe that it is easier to become a doctor in foreign countries. So what measures are in place if we are having a shortage here in the United States to ensure that there will be quality care and that those foreign doctors are up to the job?
It's a great question. It's been a real challenge in the U.S. The U.S. is not like Brazil, for instance, where Cuban doctors can come in and practice right away. Any foreign doctor coming in the United States needs to redo their residency and pass a series of exams. That's a big burden for foreign doctors, because even the ones that are highly qualified, you need to be placed in a residency program. 95% of the graduates, U.S. graduates in medical schools, get placed in a residency program. That rate is less than 40% for foreign doctors. So even getting your foot in the door once you come to the country, I think, is a real challenge. A lot of them end up working in non-medical professions, doing data analysis for pharmaceutical companies and the like. So there is a move afoot to look, can we make this easier on foreign doctors to come, because we have such a shortfall, particularly for primary care doctors.
But why the shortage in the first place?
Not enough medical schools, not enough places. For a long time, there just wasn't the urgency to expand this. Doctors' salaries were also concerned about whether or not opening up to competition, and the issues you mentioned around quality.
All right, Thomas Bollyky from the Council on Foreign Relations, thank you so much for joining us here on the show.
My pleasure. Thanks for having me.